All right. Well, I have 12 o'clock Pacific, 1 o'clock Mountain. Everyone, welcome in and thank you for taking time to join me today. My name is Jamie. I am a pre-licensure coach, and we are going to be talking about pharmacology, test-taking strategies, because we want you to be able to approach your CMS exams with confidence during licensure success. You must achieve a level 2 pre-licensure exams where they score at or below a level 1 on their first attempt. So this study was done with Unitech students on the RN side. And the thing about achieving mastery on the first attempt is you don't have to do a retake. So success on the next gen NCLEX. So pharmacological therapies, who can tell me what is the percentage of pharmacological therapies on the next gen NCLEX? Remember, this is interactive. Feel free to come off of mute. You could key it into the chat. Okay, Kelly says 16 to 20. That's close. Actually, it's going to be 13 to 16. So up to 16% of your NCLEX can be pharmacological therapies. Each question as that snapshot of patient data. We're going to assess, we're going to interpret, and we're going to prioritize. Identify key pieces of information. What is relevant or what is a distraction? And remember, do not add information to always use the nursing process. And remember your scope of practice using interpret this question. So when you're looking at an NCLEX style question, object nurse, the STEM points at the heart of the situation. And it would read, so let's take a look at our answer options. A, I will eat more spinach and broccoli to improve my health. B, I should have my INR levels checked regularly. C, I will take aspirin for headaches while on this medication. Or D, I should increase my intake of vitamin K rich foods. So, process of elimination. Let's start with eliminating A. So, remember, spinach and broccoli are high in vitamin K. Vitamin K is actually the antidote to warfarin, so it's going to have some normalized ratio level must be monitored to ensure therapeutic anticoagulation levels. Thank you so much for the interaction. For hyperthyroidism, which of the following findings should the nurse monitor to identify data? The nurse monitor to identify that the medication is effective. Following B, decreased heart rate.
Yes, A.
Okay. I have a B. Hyperthyroidism, increased with hyperthyroidism and physiological processes. Actually, the nurse should instruct the client to report which, by the case, report which Parkinson's. What are your thoughts on this question? Feel free to come off mute or key it in the chat. Okay, we have an A maybe, a D maybe, an A. Is we should be anticholinergic medication. And when Hans's question, caring for was with it. Alcohol 5 hours ago was going to cause this client to become violently ill. How about thiamine? Would you say indicated or contraindicated? Okay, Kelly says thiamine indicated. Anybody else for thiamine indicated? They have they or apple. And then, so chlordiazepoxide is a benzodiazepine in which we will administer for alcohol withdrawal. And then haloperidol, indicated or contraindicated? Maria says contraindicated.
Contraindicated.
Contraindicated. Excellent. You're exactly right. Haloperidol is a first-gen antipsychotic, and it could actually precipitate a seizure in this case. So remember, disulfiram is abstinence. This will be utilized after the withdrawal period. Again, vitamin B1 is to prevent that Wernicke's encephalopathy. Chlordiazepoxide is a benzodiazepine, and it is first-line treatment to prevent seizures or delirium tremens in alcohol withdrawal. Excellent job. Thank you so much for the participation on the CMS. You can't start any type of blood transfusion reaction. Dosage calculation can be on the CMS, including IV flow rates. Remember, there are lots of resources within ATI that will help you if you feel weaker with dosage calculation, but monitoring of a peripheral IV. Other questions you can expect: following the rights of medication administration, and ensure that you are safe with medication administration and reduction of medication errors. Their pharmacology can become very overwhelming as we're trying to learn it, but we have some strategies that'll help you learn them and retain them successfully. So what you should know about medications include indication versus contraindication. So why are we taking it versus it could cause harm if we take it? Side effect versus adverse effect. So what is common versus what is identify whether or not our treatment is working? Are we reaching those outcomes that are expected? Of what medications can be administered is to provide reinforced, and then of course, but definitely not least, one of the greatest tools to help you with covered in. So a lot of times we think, how does Maslow's hierarchy of needs meet pharmacology? Well, we use Maslow's to prioritize, right? So what we're going to do, what's happening with the client, or what needs our immediate attention? So first, we're going to meet. So let's master another NCLEX style question. And begin prior this acetaminophen that can be used later to treat any symptoms of fever, but definitely not a priority. Of course, we are going to we have to think of pharmacology across the lifespan. What does it look like with clients that are pregnant? What does it look like with our pediatric or older adult clients? What if they're breastfeeding or going to be pharmaco? As a nurse, we need to understand our therapeutic effects. So that is the desired effect. We need to be aware of our side effects, which are common, our adverse effects, which cause harm, and then toxic effects, because there are certain medications that we need to be aware of their therapeutic levels and providing education to prevent toxicity in clients. Medication is working effectively. It guides ongoing treatment decisions. So the medication ondansetron, what is the therapeutic effect of this medication?
Nausea relief.
Nausea relief, exactly. How about the medication timolol?
Blood pressure control.
Close.
Or wait, lows are the it's to decrease the heart rate.
Close. Close. Anybody else? The medication timolol? Kelly says it's an eye drop. It's for the eyes as an eye drop. And remember, with timolol, you have to do punctual occlusion, holding the finger over the lacrimal sac to ensure that it doesn't go systemic, because it can reduce the client's heart rate because it is an OLOL or a beta blocker. How about theophylline? Theophylline, if you don't know, cough dilation. So it is a respiratory med. Great job. And then how about this last medication, nicotine cessation? Excellent job, and thank you so much for the interaction. Let's take a look at this question, or this chart. So a nurse is caring for a client who is taking montelukast. Which of the following outcomes indicates a therapeutic effect of the medication? So when we rephrase it, which of the following outcomes indicates a therapeutic effect of the play couldn't do with the option C? It's a leukotriene receptor blocker. So it's gonna an adverse effect. So remember, side effects are expected and usually don't cause harm, where an adverse effect is unintended severe responses. So think about, many clients are going to be aware of common side effects, and reinforced education, again, is within your nursing scope of practice, and the opposite to the healthcare provider. And headache is very, very common side effect of nitroglycerin. How about tetracycline?
UTIs?
Staining teeth. UTI staining teeth is actually a side effect of that, Angelica, of the medication hydromorphone.
Drowsiness.
Okay, drowsiness is one. What else do common side effect of opioid medication?
Respiratory depression.
That would be now in a time during my psychs. A nurse is collecting data from a client who is receiving clopidogrel following the placement of a cardiac stent. Which of the following findings should the nurse identify as an adverse effect of this medication? So rephrase stools, or D, hypothermia.
C?
Have it. Excellent job. The lower. And if you said C, you are correct because it can cause a GI bleed. Remember, clopidogrel is an anticoagulant. Any anticoagulant medications put the client at risk for bleeding. Excellent job. Exceed that therapeutic or desired level. It's our effect. A nurse is assessing an older client who is receiving digoxin. The nurse should recognize that which of the following findings is a manifestation of digoxin toxicity. Rephrase that. I should recognize that which of the following findings is a manifestation of digoxin toxicity. So we have A, jaundice, a C. Eliminate A, eliminate B, and then we're going to eliminate C. Light. D, anorexia. So anorexia, vomiting, confusion, headache, vision changes, such as those halos now. So medication antidotes. Medication antidotes are very important to understand in the event that a client has received too much of the medication or has overdosed in the medication. So, of course, you're probably familiar with the antidote for an opioid, and that's going to be naloxone. But what happens if the client has received too high of a dose of benzodiazepine? Well, we can reverse those effects with flumazenil. And then think about your anticoagulants. Remember, warfarin, that antidote is going to be vitamin K. And then heparin, that antidote is protamine sulfate. Are received with the care of a client who is receiving heparin by IV infusion. The following medication should the nurse have available in the event? C. The client reports the sudden appearance of a painful rash with blisters on the face and trunk. A nurse's trunk. Following actions should I take first when caring for a client who has been taking Phentoin for seizure control? The client reports the sudden appearance of immediate. Let's eliminate A. Suspect comfort measure, but it's not going to address that underlying cause. Intervention needs to take place very quickly. What happens with Stevens-Johnson syndrome, and if you are not aware of it and have not seen this, I would advise you to go look at some photos online of Stevens-Johnson syndrome. There's widespread blistering of, the mucosal layers. It also involves epidermal detachment from the skin. It is an idiosyncratic reaction that, essentially the skin is sloughing off. So of course, withhold that medication, notify the provider, and anticipate hospitalization for supportive care. And like Professor Capron said, don't go do it right after lunch. Which of the following instructions should I plan to include when reinforcing teaching with a young adult female client who has been prescribed lisinopril? So as you can see, that was already rephrased. That's why I got caught up with my little typo there for just a second. But this is a select all that apply or a multiple response question. So a strategy to approach this question is to treat each option as if it is true or false. So A, report the development of a persistent dry cough, cholesterol or teratogenic. So for this question, this another indicated or contraindicated. So a nurse is caring for a 9-year-old pediatric client admitted with acute asthma, respiratory indicated, absolutely. Asthma, very good. Indicated. How about
Indicated.
Very good. How about Montelukast?
Indicated.
Very good. How about the medication propranolol?
No, not
Lucast. Indicated. Let's sneak that one in there. Prevents bronchospasm, but is not a rescue medication. A blocker. So that bronchospasm. And then propranolol will cause bronchoconstriction because it is a break your study time into manageable chunks. Your coursework. Important week for study days, 1 day off. Study for 3 hours a day, every day for the 6 days. Take a 10-minute break. Do not study more than 2 hours at any sitting. And what's going to happen with the 3 and 30 plan? One, it's going to boost your retention, which is going to create success for those 6 days. So if you think about it, that's going to be 180 questions that you remember. This plan is going to help. Blooms is a framework of how test questions are developed. Your CMS, you cannot, you're not wasting time studying what you already know. You're strengthening those skills. You're actively. So this is probably the most important notebook in nursing school because it is the one that you create yourself. So couple guidelines, 1 line per topic only. So keep it concise. If you already know it, there's no need to write it down. Include material from content you've studied or from your daily questions and put it in words that are going to help you remember it. So review this book for 15 minutes every day of your 6 study days. Put a smiley face next to it when you know it. If you don't know it, put a circle next to it. What this is going to do is take you from memorization into active application and areas of instructions that prioritize safety. Learn your medications by class instead of individual drugs. So many of the drug class should you as for learn your prefixes and suffixes, your sartans, your OLOLs, your prils. Use your question banks that mimic NCLEX format. Focus on those pharmacology. Visit your medication information tables. If you have any questions, feel free to bring them forward now. Our booking link is waiting me with some